Welcome to our lupus community. It is Lupus Awareness Month, and I'm super happy to be here to be able to do a short segment on prednisone. My name is Sheetal Desai. I am a rheumatologist in Southern California at the University of California Irvine Medical Center. I have been there now since 2007, and in 2012 is when I started the lupus clinic. And so I predominantly see lupus, although I see everything else in rheumatology. I do love helping my lupus women and men lead successful lives and educate them on their condition and really try to help them be the best advocate for themselves. So today I will be talking about prednisone, and I was flying back from a lupus clinical trial meeting yesterday, and I was trying to think of the title, and I thought The Fast and the Furious was a great title. That's how I kind of want you to think of prednisone. It really works quickly, but there's a lot of side effects that I want everyone to be aware of. And I want to preface, I have about 10 slides, so my goal is to watch the time and to get us to about 12:10. And then I have a list of questions that Lupus LA had provided me from all of you that I'll try to see how many of them I can get through. Okay, so just to give you a heads up. I do want to preface with everything that I'm telling you today is informational, but it does not replace what your own rheumatologist and your own physicians tell you. You know, nothing in medicine is black and white. There's lots of gray areas. So I just want you to be aware of that, but I will try to provide a bit of an overview. Talking about the meds that are commonly used in lupus, you know, we had several FDA approvals for medications back in the late 1940s and 1950s, and then we went over 50 years, almost 60 years before we had another medicine get FDA approved, and that was in 2011 with belimumab or Benlysta. And since then, in the last several years, we've actually had 3 additional medicines approved, which is awesome. So these are the medicines that are commonly used in lupus by most of us rheumatologists today. And I want to highlight, of all these medicines, still probably the most important medicine that we have for lupus is hydroxychloroquine or Plaquenil. And the quickest acting, or probably the worst medicine that we have long-term for lupus, is prednisone. So that is going to be the focus of this talk, but I just want to highlight how many more medicines we actually have available to us today and how many more medicines are actually in the pipeline currently being evaluated all over the country, world, at UC Irvine for clinical trials that will hopefully lead to successful additional medications for lupus. So let's talk about what prednisone is exactly. All of you are aware of prednisone. It's a very common medicine, but I want you to think about it as a version of a normal hormone that our body makes. And the part of our body that makes it are the adrenal glands. So there are glands in our body that make a similar hormone called hydrocortisone, and prednisone is a variation of that. All of us, even if we don't take prednisone, we make on average 5 to 7 milligrams equivalent of prednisone every day, and our bodies need it for normal functioning and normal metabolism. And it was actually a medical breakthrough that was found in the 1940s by a rheumatologist in the Mayo Clinic, and he actually had colleagues that were endocrinologists, and they actually found this hormone that they took out of the adrenal glands, and it was hydrocortisone, and it actually led to the Nobel Prize in Medicine in the late 1940s, and he's the only rheumatologist to date that has actually won a Nobel Prize for under rheumatology. And I tell our trainees every year as they come and work with us that if they can find a form of prednisone that works just as amazing, but without all the side effects, that they will probably get the next Nobel Prize, because prednisone changed the entire field of medicine back in the 1940s. It's not just used in rheumatology for inflammation and a lot of autoimmune diseases, but it's used all over the field of medicine for asthma, for people that have emphysema, for patients that have other autoimmune conditions, in neurology, in GI with inflammatory bowel disease. So I just want to give you an idea. It's really changed how we treat a lot of medical conditions and how quickly we're able to calm down medical conditions. And it was a form of prednisone called Decadron or dexamethasone that was very important at treating really crazy cases of COVID since 2020. So I just want you to be aware that prednisone has really changed the field of medicine and offered so many wonderful benefits. So it was approved for rheumatology in 1955 for us to be able to use it. The beauty of prednisone is it works super quickly and very efficacious at calming the immune system down and decreasing the overactive immune system. So it's really useful for flares of lupus. It's useful for when our patients are admitted to the hospital and we really need to calm them down ASAP. It's useful as a bridge to other medications because when you're not feeling well and we want to start you on something else, often those other medicines take a while to actually kick in. And prednisone can actually be a nice bridge until the other medicines kick in. And then another area where I tend to use it is pregnancy. A lot of our lupus medicines, which are great, are not usually safe during pregnancy. So when my patients with lupus are pregnant and I need to help control them, we actually treat them with prednisone or keep them on a lowish dose of prednisone throughout their pregnancy. The best times to take prednisone, I want you all to be aware, is in the morning. So like I said, I don't take prednisone. For all of us that don't take prednisone, our bodies make it endogenously, about 5 to 7 milligrams a day. And the peak actually happens in the early morning hours. So that's the reason we want you to take it in the morning, so you can synchronize when your body actually needs it the most. So I usually say about 7 or 8 o'clock in the morning, but if people wake up a little later, it's okay. And you want to take it with food. Prednisone can irritate the stomach. So if you eat something first and then you take the prednisone, that's actually the best way to do it. Now, side effects actually happen with higher doses of prednisone for prolonged periods. And it's really hard to kind of give an exact definition. That was one of the questions. But I tell people if they've been on prednisone about 7 milligrams or more for over 3 weeks, then they have to, so let's just say over 7 milligrams for over a month. That's probably the easiest way to remember it. Then you're at risk of actually getting side effects from prednisone usage. Now, you have to always weigh the risk and benefit. So if the benefits of being on prednisone outweigh the risk, then you may actually need it for your condition, but you just need to be aware that side effects do increase the longer people are on it and the higher the dose of prednisone is. When people are on short doses of prednisone, so a Medrol dose pack for 1 week, an IV infusion they get once, in a while or over a couple of days, when they get a steroid shot in the clinic, when they take it orally for less than a month, that has a lot less side effects than if you're on it longer term. And if you are on it longer term, so remember I said it's a risk-benefit ratio. Some people have to be on it long term in order to control certain aspects of their disease. The lower the dose is, the better your side effect profile is. And we used to say lower than 7.5 milligrams. Now myself and a lot of my colleagues around the country say 6 milligrams or lower is what you want to aim your prednisone dose at if you have to be on it long term. And just giving an example, outside of rheumatology, people that have had organ transplantation, whether it's a liver transplant or a kidney transplant, they have to be on prednisone for their entire duration of their life for them to be able to actually control their immune system so it doesn't affect the transplanted organ. And they're on 5 milligrams for the rest of their life. So I just want to give you an idea that prednisone, you want to go as low as possible. If you have to be on it long term, you want to get your dose 6 milligrams or lower if it is possible, right? And so we have this love-hate relationship with prednisone. We know we need it, both from me being a practicing physician, where I know it calms my patients down, and even my own patients. They know that it really calms their lupus down, but they know that all the side effects are terrible. So They use it, but they know they have to be very cautious with it. So just kind of giving you the slew of side effects to be aware of that many of you may have already experienced in some way or form is you get an increased appetite when you're on prednisone, and know all these side effects are higher at higher doses of prednisone. So I consider less than 6 milligrams, 6 or less, safe for long-term use if someone has to be on it. I consider moderate use 7 milligrams up to 20 milligrams a day, and I consider 20 milligrams or more high dose steroids. So the higher the dose of steroids you're on, the more the risk is for these side effects. People have difficulty falling asleep when they're on prednisone, so that's another reason I encourage them to take it first thing in the morning. You get weight gain over time. Some of my patients get significant fluid retention when you're on it for a period of time, especially if you have a genetic risk or you have an increased family risk of diabetes. It can increase both your blood sugar and cause diabetes. It can elevate your cholesterol levels over time. It actually causes bone issues and osteoporosis. And in some people, if they've been on very high doses, they can get bone death. And the medical term for that is avascular necrosis. And that can happen in the hips, in the knees, a lot of the bigger bones. It can affect your eyes and cause cataracts. It can cause glaucoma, which is high blood pressure in the eyes from fluid retention that happens in the eyes. It can cause increased acid reflux and ulcers in the stomach, which is why I try to tell my patients that, listen, even if you don't eat a huge breakfast, at least have a banana, have something like a piece of toast before you take your prednisone. It can cause acne. I tend to see that at higher doses where it looks like, even if my patients, are later and they've not had acne for years, they can get it on their face, on their chest, on their back. It can cause thinning of the skin over periods of time and easy bruisability. People can notice that as they go up and down on their steroid dose, that they get more anxious, more depressed. They realize that their mood actually can fluctuate. And the biggest thing that you have to be aware of is, especially if you're on moderate to high doses of steroids, it's the number one immunosuppressant we have in rheumatology. So it really works well at decreasing the immune system, which means it can increase your rate of infections. So even if you're on prednisone and you're on other medicines, I tell people that it's a combination of being on all those medicines that can increase your rate of infections. So when you take long-term prednisone, you want to make sure you take it first thing in the morning, whenever you wake up, along with food. Because we know it affects the bones, you want to make sure you get adequate calcium and vitamin D in your diet. So you don't have to take a supplement. If you're really good with milk and dairy and fortified orange juice and, green vegetables that have a lot of calcium in it, that's great. You want to make sure you get at least 1,000 to 1,200 milligrams of calcium a day, whether that's from diet or supplements as well. Vitamin D as well. You need both calcium and vitamin D to build and protect your bones. So at least 1,000 units of vitamin D, but it depends on if you're deficient. So your doctors can check your vitamin D level, and based on how low it is, they can tell you how much vitamin D you need. Exercising regularly actually helps you build bone. So even doing walking every day is a great exercise. It doesn't have to be going to the gym. It doesn't have to be running or cycling, but I encourage everyone to walk every day to help with their bone health. If you're on long-term steroids or higher doses of steroids, in addition to taking it with food, you might want to consider a medicine, an antacid, to actually protect your stomach. And this is a question that I got in the chat was, can you continue prednisone during infections? And you absolutely can. If you've been on long-term prednisone, it is not wise to all of a sudden stop your prednisone. So I would encourage you to stay on your prednisone and ask your physicians, depending on what kind of infection you have and what treatment you're getting, if you need to decrease the dose for a period of time. You can also be on it during hospitalizations. You can be on it during surgeries as well. It is not wise, if people have been on prednisone for over a month or longer, for people to stop it acutely. And so please consult with your doctor and make sure before you consider decreasing the dose or stopping it. And so, like I said, it's a risk benefit ratio. If we had better drugs that can work super quick without side effects, we would be using them. And so prednisone has a role in helping people and our patients acutely, helping them when they have flares of lupus, calming their lupus down, or low dose long term if other medicines can't control their lupus in their entirety. And you have to always weigh the risks of lupus with the benefits, the risks of prednisone for your lupus with the benefits, and decide what is a good dose for you for the optimal period of time, and seeing if you can try to minimize that as much as possible. And so when tapering it, you can talk to 20 different doctors and you're going to get 20 different tapering recommendations. Even if I see 15 patients of lupus in one clinic, I will give different tapering recommendations to different patients, depending on how long they've been on it for, what other medicines they're on, how sensitive they are to the side effects. So just please follow your doctor's recommendations. Again, if you've been on it for 1 week, you don't need to taper it. If you've been on a low dose for, a couple of weeks, it's okay. But if you've been on at least 7 milligrams or more for over a month, you definitely need to taper it slowly. And I'm watching the time, and I educate my patients that if you get off it too quickly, it's not typical side effects you might notice. It'll be nausea, it'll be vomiting, stomach pain, fatigue, dizziness, muscle cramping. So sometimes my patients get off of it too quickly and they think they had the stomach flu, but it's actually not the stomach flu. It's direct prednisone side effects from your body not being able, your normal body's machinery not being able to pick up making it inside your body. And so because you don't have normal prednisone for your body functioning, you will get these symptoms. So I want you to be aware, if you go down too quickly, the symptoms are nausea, vomiting, dizziness, stomach pain, and a lot of muscle cramping. And so I'm going to end here. And I think, Brianna, I think I did actually answer a lot of the questions, but do you want me to go through the questions you had sent me and make sure I didn't miss something?
Yeah, that would be great. I know we're coming right up to time. So if there's just a few that you could just address really quickly, that would be great. Maybe 1 or 2 of the top questions.
Yep. So I talked about steroids. You could take it in acute infection and chronic infection, and please check with your doctors. We talked about long-term use, 7 milligrams or more over a period of 3 to 4 weeks. Then it says supplements, the best supplements you should take are calcium and vitamin D if you don't get enough in your diet. If you already have osteoporosis, should you avoid prednisone at all costs? Great question. You should try to avoid prednisone, but I have patients who have osteoporosis from their long-term use of prednisone, but they still need prednisone to control their condition. So we try to go as low as we're able to go to minimize how much it continues to affect their bones. Remember, you get more side effects the higher the dose you're actually on. Let me see. How long can you take steroids in your life? Just know there's no limit. There's no limit that you could only take steroids for a week or a month or 3 months. Like I said, people that have had organ transplantation are on prednisone for the rest of their life. The key is talk to your doctor, try to minimize it. I showed the slide earlier on because I really want everyone to feel comfortable with how many medicines exist out there for treatment of lupus. And I find sometimes our patients know how terrible the side effects of prednisone are, but they're fearful of trying other medicines for lupus because they read those side effect profiles and they go, no, I don't want to try that. I'd rather just stay with what I'm comfortable with and what I know that works. And I would let you know that when you read the prednisone side effect profile, that happens in the majority of our patients. When you read the side effect profile for these other medicines, it happens in a minority of patients. So I put this up here at the end because I really want you to realize we have a lot of medicines now in the market for lupus. Please don't be fearful. We have a lot of data with these medicines. Be open to trying other medicines for lupus to see if we can get the prednisone crutch, which is what I call it, off of off of your medicine regimen or as low as possible. So I think, Brianna, I've covered a lot of it.
That was perfect. Thank you so much, Dr. Desai, for your time.
And I'll add one more thing, because it says, why does your white blood cell count go up? It goes up in all patients that take higher doses of prednisone. It's really common. When the white count is up, you don't know if it's prednisone or infection. And so you have to pay attention to your other symptoms. It goes up because prednisone does something to the bloodstream that just directly increases the amount of circulating white blood cells that are actually in your bloodstream. So just letting you know, leave it up to your doctor. It is hard sometimes for us to figure out, is it infection or is it prednisone? But we'll use multitude of different things that we have to figure that out. And I think I will end here. Happy Lupus Awareness Month. I hope this was helpful. And again, there is nothing specific that I want you to go and take away that, oh my God, I have to get to this dose or I have to do this. Please do this in consultation with your physician.